CDC study out tonight shows that in 2022, the infant mortality rate rose for the first time in 2 decades, and that is a major cause for concern. WJZ is live at 5:30. Our Stefan Dingle's in your corner with more on the data and what parents need to know. Stefan.
Hey there, Nikki. Good evening to you. This new data shows that in 2022, more than 20,000 babies here in the U.S. died before the age of 1. And if you do the math on all that, that actually shows a 3% increase in the infant mortality rate. And doctors here at home say that the best answer to all this starts with the quality of our healthcare system for women.
The infant mortality rate is an indicator of how well we're doing as a country from a system standpoint of how well are we taking care of pregnant women, delivering babies, and providing adequate care to babies.
Based on that and a new study from the CDC, it shows that the infant mortality rate rose in 2022 for the first time in 20 years, equaling out to 5.6 infant deaths per 1,000 babies, with experts saying a number of factors contribute to the alarming increase.
The first one is congenital malformations, which is a pretty consistent rate and stable. The second two are the more modifiable risk factors, which are premature births and postnatal deaths from sudden unexpected infant deaths, which is a combination of SIDS, sudden infant death syndrome.
Those factors have experts ringing the alarm to address the issue. And Dr. Scott Krugman with Sinai Hospital says, as a country, we have to support women's reproductive health and encourage those doctor's visits.
All women need access to good health care during the reproductive ages so they can get things like folic acid, to have good family planning so they can have babies when they're ready to have babies.
Experts say infant health is tied strongly to maternal health. The U.S. has long struggled with high rates of death among women during pregnancy, childbirth, or postpartum compared to other high-income nations whose rates are lower.
We really need to look at our healthcare system and how we are valuing and supporting both women before they're pregnant, while they're pregnant, and after they deliver babies. And we're actually supporting families when they have babies so that we can make sure that they get the services they need.
Now, Dr. Krugman also said in 2022 here in Baltimore, doctors saw a spike in post-birth sudden infant death syndrome, also known as SID, due to RSV and COVID, which gives you kind of a scope of the study just released today. We're live on your corner in Baltimore tonight. I'm Stefan Dingle for WJZ.
All right, Stefan, thank you. Look, there's